alone, not as much. Why? Because hydration and dehydration can alter that as it is. It's just a percentage of how much of your blood is actually blood. Which water will affect it the most? Everything else. Mainly water, waste, your BUN, creatinine, white blood cells, plasma, protein, everything else that runs in your blood. So your blood carries obviously everything, but when you, like if I get a drop of your blood, only about half, a little under half, is actually blood cell, like red blood cells. So that's why most hematocrit is between 35 to like 52, right? I think it's 37 to 52%. That's normal. So essentially 40%. The rest is plasma, other types of cells, protein, waste, and water. So if you dehydrate, what will happen to that percentage? It goes up. There's now more blood percentage because you lack water, right? My water goes down, the concentration is higher. If I overhydrate, it'll go down. Because it's the percentage of blood to everything else. Right, whether you're diluting or concentrating it. So if it's more concentrated, it's higher. If it's more diluted, it's lower. It's just fluid balance. Dehydration, it goes up. So you see, it all comes together. Term 3 is very vital, okay? Because that's where you learn the beef and potatoes of Med-Surg, just specialty. But cardio, right? Endocrine, fluid and electrolyte balances, that's your beef and potatoes of Med-Surg. If you can see those with renal as well as in there, you can do a lot with that if you understand those systems. Term 2 is easy as well, but very applicable, especially because musculoskeletal and GI. Yes.
So let's say, for example, your hemoglobin was low. So how do you distinguish if the person's anemic or bleeding?
Amazing question. Does anybody know? You can check their iron levels to see if they're iron deficient, but anemia is not specific to that. We did blood in term 3 too. You can have iron deficiency anemia, folic acid, B12. And what labs are we looking at though? So you're now looking at specifics about it. You can have a lot of B12, but you may not be absorbing it. Hence. So it's a CBC, but CBC is split into a lot. What are we looking at in CBC? RBC, WBC, platelets, hemoglobin. You look at MCV, MCVH, and there's another M something. These measure, okay, if you look in your book, it has it in there. They're not focused on. Mean corporal volume. This is how big the blood cell is, okay? The mean corporal volume as well, the other one is a percentage. These three will identify whether the cell is enlarged, its capacity to carry hemoglobin, okay? So depending on their size, you can determine if they're anemic or not. Hemoglobin is just of how much hemoglobin they got. So you're looking at the trend. But the actual volume, right, and how big they are, in B12 you'll have macrosomia, they're enlarged. While in deficiency you'll have them be small because they're not fed, they're immature. Make sense? Right, so yeah, so you can determine blood cell volume, like the size. Okay, so a hematologist will look at this. This will start telling you more about the actual red blood cells. Okay, so this is all just for anemias though. For the bleeding, it's just H and H. Okay, so I'm gonna focus more on generals just because you're towards the end, and again, the more general and more reasoning you're able to place, the better you are at answering a question. The specifics, you kind of have to like review on your own, because I know term 2 and 3, we're talking about 6 months ago. Okay, this is why it's good to keep the notes, and it's easier to review through them. We only have 5-hour days, we don't have 6-hour days, so it'll be harder, but sometimes we touch on things like that. Are we good so far with this though? Okay. But not bad on the track if obviously if they're deficient, check the iron level, check their folate, check their B12, like you'll check because they might just be lacking. Okay? CBC alone though tells quite a bit. Alright. Next one. Oh, last thing on this. So we'll put it right here, a different color. No, I'll make it part of menopause. It's okay. All right. Let's go to the next chapter, chapter 58. It depends on the type of anemia.
Oh, okay.
So some will cause it to enlarge and some will cause it to shrink. So that can matter. Like it's that's why we see 4 different types, right? That are at least we see here, which is B12, folate, iron, and sickle cell. So depending on which one it is, it'll alter the levels, and that's closer to diagnosing and as well as looking at it to then seeing like what are you like. Huh? It could be color and size, and then of course the level of the deficiency. So like then you look at iron level, B12, folic acid, and the sickle cell, they'll see. You'll have the gene for sickle cell. This is genetic. All right. Chapter 58. Now, for this one, it talks about reproductive physiological process. Well, again, focusing just on the female body, we're going to go over basically menstrual cycles and disorders of the menstrual cycle. So there's going to be a few that we're going to cover. And for some of these, I just need you to know what it is. Okay? It's just like kind of, again, very straightforward, memory and recall. Just what is this? So let's start with the first one. Now, let's read just about the reproductive cycle. So, not in the right under it, but there's another module. It says reproductive cycle. The first few words are there are different components. Okay, there are different components of a reproductive cycle, which are controlled by the pituitary gland and the hypothalamus. The ovarian cycle is responsible for the development of follicular development and mature ovum, your egg. It has 2 phases, follicular and luteal. Follicular is the first 14 days of a 28-day cycle. The luteal is the 15 to 28, so the second half. A complete menstrual cycle is approximately 28 days. This cycle affects the endometrium of the uterus and allows for implantation of a fertilized ovum and the menses. It has 4 phases: menstrual, proliferative, ovulation, and secretory. Okay? Menstrual, start of the menstrual flow, slowing of the endometrial lining of the uterus, and the process of maturation begins. Proliferation, the maturation of the egg. Ovulation occurs approximately 14 days into the menses, prior to menses, sorry. Secretory, secretion of progesterone endometrium thickens. The uterus for fertilized ovum. The 4 criteria used to define bleeding are regulatory. So, in short, what this is explaining is the menstrual cycle. Now, assuming a normal shaped uterus, and here's your cervix, right? This will lead into the vagina. This neck area here is called your uterus, where the vagina meets the uterus, okay? It looks more so like this, right? With like a little donut shape as you look inwards. This is the cervix, okay, the entry. This will soften and dilate when they're going to give birth. Now, more specific to my picture here is, as menstrual cycle continues, what's happening is that so when you're gonna ovulate, it'll come to the fallopian tube, and it rests here. This is where fertilization occurs. Now, should it be fertilized, as it moves on down, it'll implant into the uterus. So during the menstrual cycle, this begins to thicken. Now, ideally, it'll implant near the top. It could implant lower, but this then causes complications with recovering ovulation. So, as this happens here, an implantation occurs, right? Then it'll develop into a placenta as it proliferates, and then, right, you start developing your little babies. Okay? Now,
Finish your thought.
if that doesn't occur, so no baby, all of this will eventually fall out. The lining, the thickening, okay? And then you resume the cycle again and again.
Hi, what's up, term 4? I haven't seen you guys since the new term 4 started. So far, so good? Stuff falling out? All right. We just have a quick announcement. Falling out. Falling out.
Speaking of falling out. We're here to give you guys some information because you're gonna be receiving an email, likely the end of the week. And it comes from our friend Do Not Reply, and it's a disclosure. And what we're disclosing is effective July 1st, 2024, there's a new curriculum version for VM. And the new curriculum was mandated by the federal government, the Department of Education, and we had to make changes. There was no negotiating. And we had to make those changes, which we submitted, and it's all been approved, in order for students to continue to get Title IV funding. Okay, so the good news is it's submitted, it's done. Why we need to let you guys know about this, and we don't anticipate that it's going to apply to you, but if in this term you're not successful in any course and you have to repeat, or if something happens and you have to take a leave of absence, or if you're dropped and you want to appeal and come back, it will likely be under this new curriculum, which is different than the curriculum that you're in. So it's important for you guys to know that if that happens, and if it does, we'll work with you, but there are changes. So this disclosure is gonna come to you in an email, likely at the end of the week. We just wanted you to know about it, have a chance to, if you have any questions, we can answer them. But we're asking for you to look out for that email, read it, sign it, initial. There's 3 places to initial and a signature. It's an e-sign, and get that back, and it goes automatically into your file. So I'll stop there. Any questions about this? Yeah. The changes are, it's less hours.
Oh,
No,
everyone thinks
it's not, you guys, honestly, it's not better. And I'm saying that, I'm not just saying that to make you feel better, I firmly believe it, but it was a mandate from the federal government in order for students to have Title IV funding. The curriculum that you're in is better, we have great outcomes. Anytime you've got great outcomes on a curriculum that's proven and you go and reduce the hours, you're putting in risk that you might not have those great outcomes. It's never better when you take hours away.
Right. Just imagine doing what you do now and with less time.
How less of hours?
Yeah, is it the clinicals or theory hours?
The clinical hours, it's like 2 hours difference.
That makes
That's
sense.
2 hours difference. That's 2 hours.
The rest, it's theory, and it honestly, and I would say this to Joe Biden, I don't agree with it. I think it's bad. But when, you know, we don't always agree with what the federal government says, and we had to do it, and this wasn't something that they, let schools know, like, hey, beware, like flash, flash, flash. Literally, it was kind of like under the radar, and Susan Pillay, who's our co-president, was at a conference, and her friend told her about it. Because when you have to change your curriculum, it's not easy, it takes a lot of time, and so we had to like, literally, I would go into like a room where no one knew where we were and put this all down and get it done. We had to get it approved with the Board of Vocational Nursing and Psychiatric Technicians, ABHES and BPPE, all from being notified February 1st for a new curriculum in July, and that's not easy to do. So we just, you know, that's a big hit to students not getting Title IV funding.
So is that gonna reduce the time frame of the program instead of 18 months?
No,
We just
It's
do
still
this
the same
and do
time
this
frame.
out.
It's just a daily
Right.
yeah.
It's not
We are working on another curriculum for future to go term-based, that might lessen the length of the program, but that's way off. But that's something that, based on feedback we've heard, so looking at that, but that's not any near the future. Any other questions, and you can get back to the uterine lining falling out? No? All right, thanks for listening, and it'll probably come at the end of the week.
You're all gonna graduate, so don't even.
It
don't even matter.
Yeah. Because you're all gonna finish. Okay, September. Sorry for the
No,
interruption.
you're fine, you're fine.
Thank you, Mr. Armando.
Alrighty. So, let's continue. So, reproductive cycle, right? Alright, menstrual disorders. There's 3, 4 that I want you to, know. And these are the names. Dysmenorrhea. You'll see it there. I think it's pronounced dysmenorrhea. Okay. Amenorrhea. Menorrhagia. And mesorrhagia. So if we read across menstrual disorders, you'll see that dysmenorrhea is painful menstruation. Painful menstruation. Now, generally there is cramping, discomfort, and pain involved, but dysmenorrhea implies an excessive amount or in many clients, this significantly decreases after birth of a child or the client becomes older. This is more common in the younger population. Okay, so expected findings, again, backaches, headaches, cramping in the pelvic area, nausea, dizziness, okay? And I just need you to know again that it's that, painful menstruation. Amenorrhea, the absence of menses. Okay? Now, I will point out for those that are not familiar, when she lives with the menstrual cycle, I, to my shame, will admit that I did not understand this until nursing school. I didn't find out this piece of information until I was like 19. I thought when women menstruated or had a period, it was like 28 days like it says.
Oh my God.
Let's say it landed on Friday. And at Friday around 1 p.m., you would just have one bleeding episode. Like, here you go. That's a period. And that was it. Hold on. And then a whole another month till the next one. You get what I mean? It's like, there you go. Like, check it out. You're not pregnant, here you go. That's what I thought. Then I further realized that, let's say it begins on Friday, this usually continues for approximately 2 to 4 days. That can vary widely and become longer possibly. Okay, so it's 2 to 4 days of, you can say bleeding, but then there's still what they consider spotting, which is like scant. Okay, this can start as far as the first day up until 6 to 7 days. Okay, so it is a process, and it's just so that everybody's aware. I say this as well just because it's better to be informed than for you to be ill-informed in working, because some of you will work in clinics where this can be involved, deal with, pregnant women, female bodies, so you're more informed, okay? Now, another mistake that I commonly see is somebody reported vaginal bleeding on a 65 older woman, okay, 65 years and older, which we're gonna go into next, which is menopause, okay, the absence of menses. When it's done, or they've had hysterectomies, you shouldn't expect menstruation, you shouldn't expect a period, okay? It's not what's usually causing it at that age. So understanding this is vital to proper assessment when it comes to females, okay? So, covering that. Now, certain things can cause amenorrhea, and it has its own little section, right? This is on page 439, chapter 58. Amenorrhea, absence of menses. This can, lead to many medical conditions. It can also be due to pregnancy. In pregnancy, you're not menstruating anymore, so it is amenorrhea. Thyroid disorder, that they don't have enough thyroid hormone or too much, can cause it as well. This can also just be primary amenorrhea. You haven't started menstruating. Okay. Now, something to know is delayed is considered delay in menarche by 15 or no menarche by 16 years of age. So if there is 15 to 16 years of age, they have not begun, then this is now delayed, and you should talk to a medical provider about it. Alrighty. Now, oligo amenorrhea. This is infrequent. Okay, because amenorrhea is when you stop for, I believe, 3 cycles. At least 3 cycles or 6 months. Right? But if you're just infrequent, you're usually late, right? Oligomenorrhea. Yes.
Is the 3 to 6 months the secondary or the following?
The secondary, because they began it already.
But not the all.
Primary is just, we know why not. You have not begun.
I'm not
So there's
confusing it between the secondary and the all late.
So primary is, when we're talking about the front, this applies to your secondary amenorrhea. Okay. The biggest thing is, and you will get by just fine if you know that amenorrhea is absence of menses. Now, menorrhagia and metrorrhagia. Sorry, there's an R right here. Menorrhagia is excessive menstrual bleeding. Excessive bleeding and menstruation. And metrorrhagia has breakthrough bleeding between menstrual periods. So, this is breakthrough, they'll call it, meaning like sudden breakthrough bleeding. So bleeding in between menstrual periods. Metrorrhagia. Then you would have to, again, since it's abnormal bleeding, you would have to get checked out as to what it is. Is it delayed emptying? Is it menstrual bleeding in between? Is something else making you bleed? So then it can vary. Okay, you just need to know the terminology for them. What are they?
Mr. Armando,
Yes.
for Metro Asia, is it that you finish your 7 days and then in between the 28 days, you bleed in between?
Correct.
Okay.
All right. Are we good with this? Okay. So this should be the last point to make, which is perimenopause and menopause. This is in page 440 it begins. You'll see it as a module, perimenopause and menopause. So we have to finish up today. Yes.
For the dysmenorrhea for painful menstruation, is it too much to ask how it actually gets painful? Like what causes so much cramping? Like how do you determine regular, like the patient comes in, you know what I mean?
I would think, so, and that's there, I try to make that emphasis where obviously there is discomfort, pain, cramping. I would suggest that at that point it's subjective
Okay,
to you.
okay.
Like, is this pain so unbearable that it's taking you out, from your daily activities? Like, do you need to call off work? It's really severe, like, you're gonna go to the doctor when at the point that you don't stand anymore. Like, this interferes with my day. Like, every month, 1 to 3, 5 days, I'm out. Like, I can't function due to the pain and discomfort.
So what's happening in your mind, for it to be
It's-
so
It's,
severe?
it's more so the contraction, because there is like some contraction to it, hence the cramping.
Yeah,
Now, again, the tension or the amount of nerve that you're feeling, that could be subjective.
Okay.
I don't know too much in depth to tell you this is
Okay.
making it worse or this is why you feel it more,
okay,
but I'm assuming that it's just also subjective. People tolerate pain
different.
differently, so it can be, and some people just know, just talking within enough people, you'll see that someone's like, yeah, it bothers me, but it's not a problem. Some people are like, yeah, I can't. And a lot of people say it's gotta go over time. It could be due to hormone imbalance. Food, some people have triggering foods.